I am Regina Bash-Taqi, the Country Director for Health Poverty Action in Sierra Leone. The main health problems in Sierra Leone are poor maternal health, so the facilities we have for emergency obstetrics are very weak. We don't have ambulances, we don't have enough midwives or doctors, so that's one of the main problems. Another problem is malaria. Obviously the mosquitoes are there and it's very hard to prevent people being bitten. And then the third is because we don't have access to clean water everywhere, diarrheal diseases like typhoid are a big problem. I think almost daily life is quite a worry. So if you know, for most people in the West, if you're going to give birth to a child, that is like an exciting time. But in Sierra Leone, you'll be very worried about whether you'd have a safe delivery. Same with if you have children, you're constantly battling against malaria and you're constantly battling against diarrhea. I will say people are rich in spirit, but they are so poor in resources, and just as well that they are rich in spirit, otherwise they wouldn't be able to, you know, life is survival, so you worry every day when you wake up in the morning about how you're going to feed your family, you worry about how your child is going to get to school, you worry about transport. Yeah, so I think the only thing that balances that is just the amazing resilience that people have. They will be able to think more long term, you know, you would be able to say, look at your girl child and you're not just thinking, here's my daughter, I want her to get married so that, you know, hopefully I get a rich son-in-law. You'll be thinking more, okay, I hope she, you know, goes to university. I'm not just looking for the quick return, but it's very hard to do that when you're in the situation that a lot of people are. Even if I say so myself, amazing work in terms of health. The interventions that we do, so we help hospitals and clinics to be able to deliver better service to communities. But more importantly, what we do is we actually help to educate the communities so that they know, you know, when to go to hospital and what services are available. And that's, you know, it sounds silly and it sounds small, but it's a really important thing because a lot of people don't know when they need to use health services. The other thing that we've been doing a lot of work on is actually trying to empower women. So again, you know, if you're in a Western context, you might not really see this, but some of the places where we work, a woman might be quite ill or trying to give birth, but because her husband's not around, she can't make the decision to go to hospital. So we've been working a lot with communities and trying to empower women and allowing, you know, and for communities to accept that women should have that right to those decisions. So one of the things that we've been doing, for instance, in terms of trying to, you know, empower women is develop ways for women to earn more income. So a lot of women, usually before known as traditional birth attendants, who would help a woman deliver at home, we're now working with them to change what they do. The reason being that although they do a great job when it's normal deliveries, they're not able to handle emergencies. And actually a lot of the maternal deaths that occur in our region is sometimes due to their work. So what we're encouraging them to do is to get people more to the health center and support them there. But this means then now that they don't have an income because they used to get a small income from, you know, delivering themselves. So we're looking at ways in which they may be able to sell specific products. It's early days, but we hope that that's something that we can develop nationally. They can take an interest, so if you know, if they're watching this video there already, and they can try and understand a bit more how their governments, what their governments do, and how that impacts on what's possible. I think long and short of it is governments, including the government of Sierra Leone, have responsibility to the people, and it's about how the UK public can support and encourage the government of Sierra Leone to do the best that it can for its people.